In this presentation, we will introduce you to AirPal, a patient handling system that has been designed to reduce the risks associated with lateral transfers and repositioning, regardless of the size of the patient or the caregiver. The two key components of the AirPal are the transfer pad with detachable sanitary protective liner, referred to as the Sana liner, and the air supply unit. A simple on-off switch activates the air supply, sending air to inflate the transfer pad. The underside of the transfer pad features hundreds of perforations that allow air to escape. Much like the concepts used on an air hockey table, this creates a thin layer of air between the transfer pad and the surface. As a result, shear is greatly reduced as your patient glides across the surface on a cushion of air. The AirPal transfer pad features stabilization bands sewn into the underside of the pad. These bands help center and cradle the patient on the pad. On the upper side of the transfer pad, there are two safety straps, much like seat belts, for added patient security. Additionally, there are extended non-magnetic tabs that attach the sanitary liner to the transfer pad. This allows the Sana liner, which is wider than the transfer pad, to cover all exposed seams. As a result, additional protection from contamination is achieved, along with reducing the need to launder the pad. The color-coded tabs and bands on the transfer pads correspond to the various width sizes available. Black, 18 inches and 26 inches. Yellow, 28 inches. Blue, 32 inches. Silver, 39 inches. And orange, 50 inches. Please note, the 50-inch side transfer pad requires two air supply units. The extended length of the AirPal's transfer handles permit a safer upright posture for the caregiver. This is especially important for wider bariatric surfaces, which force caregivers to lean across a greater width to grab draw sheets or other transfer mechanisms. When transferring to a stretcher, a raised side rail adds extra security, but it also reduces the caregiver's reach, particularly for the shorter caregiver. The AirPal's extended reinforced sidewall handles enables shorter caregivers to perform transfers with greater ease and safety. When using the air supply unit, you may conveniently hang it from the foot end of your bed or from the mobile basket stand available as an accessory. Patient placement on the AirPal will vary by department and according to which bed or transfer device is being used. If the patient is already in bed, you can place the AirPal under the patient by using your standard or linen changing procedure or log rolling technique. Always center your patient on the pad with their feet positioned on the end with the label marked as foot end. To begin the transfer, make sure that the air supply is plugged in to a standard AC outlet. Connect the free end of the flexible hose to the transfer pad by inserting it into the small pockets on either side of the foot end of the pad. In order to achieve proper inflation of the pad, snap the hose on to the transfer pad and close and snap the sleeve snugly around the hose. Now, depress the power button to turn on the air supply. A green indicator will illuminate to tell you that the air supply is in operation. The transfer pad will inflate with low air pressure and gently lift the patient. To perform this transfer, simply pull on the upper torso first so that it leads the foot section by 16 to 24 inches and then follow with the foot section. Please note, always have the side rail of the receiving stretcher or stretcher chair in the raised and locked position with all wheels engaged. Once you have completed the transfer or repositioning of the patient, turn off the air supply. The air supply is only meant to be powered up for the duration of the patient movement. Please note, the patient can remain on the AirPal transfer pad for nearly all medical procedures. It is radiolucent and artifact-free. To clean the transfer pad between patients, wipe down the pad using paper towels or a disposable cleaning cloth, and a properly diluted EPA-approved germicidal cleaning solution. For badly soiled pads, the AirPal may be laundered. Please read the cleaning and laundering instructions located on the transfer pad and Santa liner to extend the life of the product.